The emergency room doors exploded inward at 2:47 a.m., and nobody was ready for what came next. A soldier, face gray, uniform soaked in blood, stumbled through on a gurney pushed by two paramedics. His eyes rolled back. His breath came in wet, rattling gasps. Then he saw her. The woman in the corner. White scrubs. Mop in hand. Quiet. Invisible. His arm shot up, trembling, weak, into a salute. "Commander Keller," his voice cracked. You saved my life in Kandahar." Every head in the ER turned. The woman didn't move, didn't speak, just stared at him like she'd seen a ghost. Then his heart monitor screamed, and he flatlined. If you want to know how a janitor became the most dangerous person in that hospital, and how the people who dismissed her were about to beg for her help, stay with me until the end. Like this video, drop a comment with the city you're watching from so I can see how far this story travels. And let's dive in. Evelyn Keller had been wiping down the same stretch of linoleum for 3 months. Same hallway, same scuff marks, same fluorescent lights that buzzed like dying insects overhead. She moved through the emergency department at Riverside General like a shadow, unnoticed, unimportant, exactly the way she wanted it. Tonight was no different. She pushed her cart past the nurses' station, past the residents huddled around their tablets, past the attending physician who didn't even glance her way. She was furniture, background noise, the kind of person you only noticed when the trash hadn't been emptied. That was fine. She preferred it that way. The ER was quiet tonight, too quiet. A few patients in the waiting room, a kid with a broken arm, an elderly man coughing into his fist. Nothing urgent, nothing that required her to think about anything except the rhythm of the mop against the floor. Evelyn had worked the graveyard shift every night for 12 weeks straight. She clocked in at 11, clocked out at 7, and spent 8 hours making sure the floors were clean enough that nobody slipped on blood or vomit or whatever else came through those doors. It wasn't glamorous. It wasn't important. But it was simple, and simple was exactly what she needed. She'd chosen Riverside General specifically because it was small, a community hospital on the edge of the city, far enough from the major trauma centers that she wouldn't see the kinds of cases that made her hands shake, far enough that nobody would ask questions, far enough that she could disappear. And for 3 months, it had worked. She kept her head down, didn't talk to anyone unless she had to, ate lunch alone in the supply closet, avoided eye contact, wore her hair pulled back tight, no makeup, nothing that would make her stand out. She'd even started wearing reading glasses she didn't need just to change her face a little. Nobody recognized her. Nobody knew. And that was exactly how it needed to stay. She pushed her cart past the vending machines, past the restrooms, past the bulletin board covered in flyers for hospital charity runs and potluck dinners. She didn't read them, didn't care. She wasn't here to make friends. The automatic doors at the ambulance bay slid open, and a gust of cold November air swept through. Evelyn pulled her thin cardigan tighter and kept mopping. Outside, the parking lot was empty, except for a few cars and an ambulance with its lights off. Quiet night. She almost smiled. Then the doors slammed open. Evelyn looked up. 2 paramedics burst through, wheeling a gurney at full speed. A man in military fatigues lay on it, chest heaving, face pale as chalk, blood soaked through the gauze wrapped around his abdomen. His eyes were half closed, unfocused, pupils blown wide. "Gunshot wound to the lower left quadrant," one of the paramedics shouted. "BP's dropping fast, 80 over 50 and falling. We need a trauma bay now." A resident sprinted forward, phone still in his hand, barking orders. "Bay 2, get me a surgical consult and type and cross for 4 units. Nurses swarmed. The gurney rattled past Evelyn, wheels screeching on the freshly mopped floor. She stepped back, pressing herself against the wall, making herself small, invisible. Then the soldier's eyes opened. He looked right at her. His hand lifted, shaking, trembling, and snapped into a salute. "Commander Keller." The words came out weak, barely a whisper, but they carried across the room like a gunshot. Every single person stopped. The resident froze mid-step, his mouth hanging open. The nurses turned, confusion written across their faces. Even the paramedics looked around, trying to figure out who he was talking to. Evelyn's grip tightened on the mop handle. "You saved my life," the soldier rasped, his voice cracking. "Kandahar, you pulled me out of that transport. I remember your voice. You told me to stay awake. You told me I was going home. The heart monitor shrieked. His body convulsed. His eyes rolled back. Flatline. Shit! The resident lunged forward, slamming his hands onto the soldier's chest. Start compressions! Get the crash cart! Move, people! Evelyn didn't move. She watched the chaos unfold, watched the resident pump frantically, watched the nurses scramble for equipment, watched the monitor stay flat, that horrible unbroken tone screaming through the room. Wrong rhythm, wrong hand placement, too shallow. They were killing him. Move! A doctor shoved past her, a tall woman with sharp features and an even sharper voice. Dr. Cassidy Voss, head of the trauma department. Evelyn had seen her before, barking orders, running codes, tearing into residents who made mistakes. What the hell are you all standing around for? Bag him. Get an airway. I want a line in him right now. Move. The nurses scrambled. One grabbed the bag valve mask. Another fumbled with an IV kit. Evelyn turned away. This wasn't her problem. Not anymore. She went back to her mop. Behind her, she could hear Dr. Voss shouting, Faster! You're barely moving blood. Put your weight into it. The resident's voice came out strained. I am. Then you're doing it wrong. Evelyn squeezed the mop handle so tight her knuckles went white. Wrong angle. He was too high on the sternum. Compressions weren't deep enough. And his rhythm was erratic. Panic made people speed up when they should slow down. CPR wasn't about strength. It was about precision. About knowing exactly where to press. How hard. How fast. She'd done it 1,000 times. In tents. In deserts. In the back of helicopters while bullets punched through the hull. She'd done it so many times she could do it in her sleep. But that wasn't her job anymore. She dipped the mop in the bucket and kept moving. Clear. The defibrillator pads hit the soldier's chest. His body arced off the table, back bowing, arms jerking. Nothing. The monitor stayed flat. Again, charge to 300. Clear. Another jolt, another flat line. Dr. Voss cursed under her breath, her jaw tight. We're losing him. Push another round of epi, and someone get me a surgical consult down here now. A nurse fumbled with the syringe, hands shaking. The resident was still doing compressions, but his arms were shaking too. Sweat dripped down his face, his breath coming in gasps. Evelyn kept her eyes on the floor. She could hear the rhythm. Too fast. Too erratic. They were panicking, and panic killed people. She squeezed the mop handle tighter. Not your fight. Not anymore. You walked away. You chose this. Time of death? No. The word came out before she could stop it. Dr. Voss turned, her eyes narrowing. Excuse me? Evelyn looked up. You're doing it wrong. The room went silent. Everyone stared at her. Dr. Voss stared at her like she'd just spoken a foreign language. I'm sorry, what did you just say? Your compressions. Evelyn's voice was flat, calm. The voice she used to use when she was explaining a procedure to a field medic who was 2 seconds away from freezing up. You're too high on the sternum. You're not hitting the heart, and your rhythm's off. You're going too fast. The resident stopped mid-pump, his face flushing red. Are you seriously trying to tell me how to do my job? Evelyn didn't look at him. She kept her eyes on Dr. Voss. Voss took a step forward, her voice dropping to something dangerous. Who the hell are you? Evelyn didn't answer. Dr. Voss took another step. You're a janitor. You clean floors. You empty trash. You do not give medical advice in my ER. Do you understand me? Evelyn turned back to her cart. I said, do you understand me? She grabbed the mop. Security? Doctor. Voss's voice cracked like a whip. Get her out of here, now! Footsteps echoed down the hall. A security guard appeared, hand already moving to his radio, his expression bored. Ma'am, you need to come with me. Evelyn started walking. Behind her, the heart monitor screamed, that flat, endless tone. She stopped, closed her eyes. And suddenly she wasn't in Riverside General anymore. She was back. Sand in her teeth, heat crushing down like a weight, the smell of blood and diesel and smoke thick enough to choke on. A voice, young, terrified, gasping her name. Commander, please, don't let me die, please. She'd promised him. She'd looked him in the eye and promised, and then she'd failed. Evelyn opened her eyes, turned around. Move. The resident blinked. What? I said move. Her voice was different now, cold, flat. The voice that had once commanded field hospitals under mortar fire. Dr. Voss stepped forward, her face dark. If you don't leave right now, I will have you arrested. I will have you charged. Do you understand me? Evelyn looked her dead in the eye. You can arrest me after I save his life. She shoved past the resident, dropped the mop, and pressed her hands onto the soldier's chest. The compressions were different, harder, faster, precise. 1, 2, 3, 4, 5. She counted in her head, her body moving on autopilot. What the hell do you think you're doing? Doctor. Voss grabbed her shoulder, trying to pull her back. Evelyn didn't even glance at her. Bag him. 2 breaths every 30 compressions. Do it now. A nurse hesitated, looking at Dr. Voss. Evelyn kept going. Her hands moved like clockwork. 30 compressions. Pause. Bag him, she said again, her voice cutting through the noise. The nurse moved. The bag valve mask went over the soldier's face. 2 squeezes. The chest rose and fell. Evelyn kept going. 30 compressions, 2 breaths. Repeat. You need to stop right now yet, Dr. Voss started. He's got a tension pneumothorax. Evelyn's voice was flat, clinical. The same voice she'd used 100 times when she was elbow deep in someone's chest cavity. His lungs collapsed. The air's building up in the pleural space, compressing his heart and his vena cava. That's why your compressions aren't working. That's why the epi's not working. You're trying to restart a heart that's being crushed. Doctor. Voss opened her mouth, then closed it. Evelyn didn't stop the compressions. Get me a 14-gauge needle, a long one, and a syringe. Now. Nobody moved. She looked up, her eyes hard. Now. A nurse scrambled, grabbed a needle from the crash cart, handed it over with shaking hands. Evelyn didn't hesitate. She stopped compressions, ran her fingers along the soldier's chest, found the second intercostal space mid-clavicular line, and drove the needle straight in. There was a hiss. Air rushed out, loud and sharp. The heart monitor beeped. Once. Twice. Then steady. The soldier's chest rose. The room was dead silent. Evelyn stepped back, pulling the needle out. Her hands were shaking now, adrenaline crashing through her system. Dr. Voss stared at her, her mouth open. What did you just... Evelyn didn't answer. She turned, grabbed her mop, and walked toward the exit. Behind her, the soldier's eyes fluttered open. Commander? She didn't stop. She couldn't. If she stopped, she'd have to think about what she'd just done. And if she thought about it, she'd remember why she'd stopped doing it in the first place. Evelyn made it to the supply closet before her legs gave out. She sank onto an upturned bucket, pressing her hands against her knees. Her breath came in short, shallow bursts, her vision tunneling. Not again. Not again. She'd left that world behind. She'd walked away. She'd buried the uniform, deleted the contacts, changed her name on every form that mattered. She'd spent 3 months scrubbing floors and taking out trash and doing everything she could to forget. But it didn't matter. It always came back. The door opened. Dr. Voss stood in the doorway, her arms crossed, her expression unreadable. What the hell was that? She said quietly. Evelyn didn't look up. You were killing him. I wasn't asking about the patient. Dr. Voss stepped inside, letting the door swing shut behind her. I'm asking about you. Evelyn said nothing. That wasn't luck. Voss's voice was softer now, almost curious. That was training. Years of it. The way you moved, the way you assessed him, the way you did that needle decompression without even thinking about it. That's not something you learn from a first aid course. Evelyn stood. I need to get back to work. Who are you? Nobody. She pushed past Dr. Voss back into the hallway. Voss didn't follow, but Evelyn could feel her eyes on her back, feel the weight of the question hanging in the air. She kept walking. The rest of the shift was a blur. Evelyn mopped floors, emptied trash cans, restocked gloves in the exam rooms. She kept her head down, her hands busy, her thoughts locked away in the part of her brain she didn't let herself visit. By the time her shift ended, the sky outside was turning gray, the first light of dawn creeping over the horizon. She clocked out, grabbed her coat from her locker, and headed for the exit. The ER was quiet again. No emergencies, no chaos, no soldiers calling her name. She pushed through the doors, stepped into the cool morning air, and took a breath. It was over. She'd slipped, but it was over. She started walking toward the bus stop, her sneakers scuffing against the pavement. Then she heard it. Sirens. Distant at first, barely audible over the hum of early morning traffic. Then closer. A lot of them. She stopped, turning. Down the street, lights flashed, red and blue and white, strobing in the gray dawn. Ambulances, fire trucks, police cars. A convoy. Her stomach dropped. The radio on the security guard's belt crackled to life, loud and sharp. All available personnel to the ER mass casualty event. Building collapse downtown. ETA 2 minutes. Repeat, mass casualty event. Multiple critical injuries inbound. The guard's face went pale. He turned and sprinted back inside, shouting into his radio. Evelyn stood frozen on the sidewalk. Mass casualty. She knew what that meant. She'd lived it. Tents full of broken bodies. Blood everywhere. Screaming. The smell of burnt flesh and cordite. Decisions made in seconds. Who lived? Who waited? Who died? She turned to leave, her heart pounding. Keller? Dr. Voss stood in the doorway, still in her scrubs, her hair pulled back tight. Don't even think about walking away, she said. Her voice was calm, but there was something underneath it, something desperate. Evelyn shook her head. I can't. Yes, you can. I can't. Then people are going to die. Voss stepped closer, her eyes hard. And you're going to have to live with that. Again. Evelyn's hands curled into fists. The sirens were louder now, so loud she could feel them in her chest, vibrating through her ribs. I don't do this anymore, she said quietly. Then what the hell are you doing here? Voss's voice cracked, just a little. You think I didn't see you in there? You think I didn't see the way you moved? You were made for this. And right now I have 6 critical patients about to come through those doors. And I have 3 residents who've never worked a mass casualty event and a nursing staff that's already stretched thin. So you can walk away, or you can help me save lives. Your choice. The first ambulance pulled up, tires screeching. The doors flew open. A paramedic jumped out, face wild, uniform covered in dust and blood. We've got 6 critical. Building collapse downtown. Structural failure, multiple floors pancaked. We need every hand you've got. Dr. Voss looked at Evelyn. Evelyn looked at the ambulance, at the blood, at the chaos spilling out onto the pavement, at the faces of the people who were about to die if someone didn't do something. She closed her eyes, heard the voice again. Don't let me die. She opened her eyes and walked back inside. The ER exploded into chaos. Gurneys crashed through the doors, patients screaming, bleeding, broken, nurses shouting, residents scrambling, alarms blaring from every direction, a cacophony of noise that would have sent most people running. Evelyn stood in the middle of it all, frozen. Too much. Too fast. Just like before. A resident ran past her, wild-eyed, his hands shaking. We don't have enough beds. We don't have enough people. What do we do? Doctor. Voss grabbed him by the shoulder, spinning him around. Triage. We triage. You know how to do that, right? Yes, but then do it. Now. He stumbled away, looking lost. Voss turned to another nurse. Clear the waiting room. I want every non-critical patient out. Call in the off-duty staff and get me a count on available beds. The nurse nodded and ran. Evelyn watched it all unfold, her heart hammering in her chest. This was a mistake. She shouldn't be here. She couldn't do this. Another gurney crashed through. A woman, mid-20s, covered in concrete dust, her leg twisted at an angle that made Evelyn's stomach turn. She was screaming, her voice raw. A resident ran up, froze. Where do I? Figure it out, Voss snapped. He stood there, paralyzed. The woman kept screaming. Evelyn's hands twitched. Voss turned to her, desperation written across her face. I need you. Evelyn's throat was dry. I told you. I don't care what you told me. Voss's voice was steel wrapped in velvet. You know how to do this. I saw you. I saw the way you moved in there, the way you assessed that soldier. You've done this before. A lot. So either help me save these people or get the hell out of my way. Evelyn looked at the chaos, at the blood, at the fear, at the woman screaming on the gurney. She took a breath, and something inside her shifted, clicked, like a switch flipping. Her voice, when it came out, was different, cold, calm. Command sharp. Clear the waiting room. Set up triage in the main hallway. Red tags go to trauma bays 1 and 2. Yellow tags to 3 and 4. Green tags to the waiting area. Black tags. She paused, her jaw tight. Set them aside. Dr. Voss stared at her for half a second. Then she turned and started barking orders. You heard her. Move. Evelyn moved. She grabbed a triage kit from the crash cart, stepped up to the first gurney, and assessed the patient in seconds. Middle-aged man, crushed pelvis, weak pulse, shallow breathing, skin cold and clammy, red tag. She slapped it on his chest and moved to the next. Young woman, head laceration, bleeding but not spurting, conscious, responsive, pupils equal and reactive, yellow tag. Next, elderly man, no pulse, no breath sounds, fixed and dilated pupils, black tag. She moved down the line, tagging, sorting, deciding who lived, who waited, who died. It was brutal. It was necessary. It was what she'd been trained to do. Behind her, the ER started to organize. Nurses moved patients according to the tags. Residents prepped the trauma bays. Dr. Voss coordinated, directing traffic, her voice cutting through the chaos. But Evelyn didn't stop. She was on autopilot now, muscle memory taking over, battlefield instinct. She reached the fourth gurney. A teenage boy, maybe 16, his chest crushed, breathing shallow and rapid. Tracheal deviation, distended neck veins, tension pneumothorax, just like the soldier. Red tag. Fifth gurney. A construction worker, arm nearly severed at the shoulder, tourniquet already in place but soaked through with blood. Red tag. Sixth gurney. A man in his 30s, construction vest, rebar sticking out of his chest, right side just below the clavicle. His breathing was labored, bubbles forming around the wound, sucking chest wound. Evelyn's stomach dropped. She looked at the angle of the rebar, looked at the blood pooling underneath him, looked at his face, gray and sweating. He looked up at her, his eyes glassy with pain and fear. Am I going to make it? Evelyn hesitated. She knew the answer. The rebar had probably nicked the subclavian artery. Maybe worse. The second they pulled it out, he'd bleed out in minutes, and they couldn't leave it in. Either way, his odds weren't good. But she looked him in the eye, and she lied. Yeah, she said quietly. You're going to make it. She tagged him red and wheeled him toward Trauma Bay 1 herself. Dr. Voss met her there, her eyes widening when she saw the rebar. Jesus, he's not going to survive transport to surgery. I know. Then what are you... Evelyn looked at her. Get me a thoracotomy tray, rib spreaders, vascular clamps, sutures, and tell everyone to clear the room except the people I absolutely need. Voss's eyes went wide. You're not seriously thinking about doing an emergency thoracotomy in the ER. He's got maybe 5 minutes before he exsanguinates. Surgery's 10 minutes away on a good day. So unless you've got a better idea, get me the damn tray. For a long moment, Voss just stared at her. Then she turned. You heard her. Move. I want a thoracotomy tray in here right now, and get me anesthesia. Evelyn pulled on gloves, her hands moving automatically. She looked down at the man on the table. He was still conscious, barely. His lips were moving, but no sound came out. Hey, she said softly, leaning close. What's your name? Marcus. His voice was barely a whisper. Okay, Marcus. I'm going to take care of you, but I need you to stay with me. Can you do that? He nodded, tears streaming down his face, cutting tracks through the dust and grime. A nurse appeared with the tray, hands shaking as she set it down. Evelyn looked at the instruments. Scalpel, rib spreaders, clamps. She'd done this before, in tents, in helicopters, in the back of Humvees while mortars exploded outside. But never like this. Never in a hospital, with witnesses, with people watching. Never where it mattered this much. Dr. Voss appeared at her shoulder. Anesthesia's 2 minutes out. We don't have 2 minutes. Evelyn picked up the scalpel. Hold him down. Voss's face went pale. You're going to do this without anesthesia? He's going into shock. He won't feel most of it. Evelyn looked at her. Hold him down. Voss moved, pressing her hands on Marcus's shoulders. Two nurses grabbed his legs. Evelyn took a breath. She looked at Marcus one more time. I'm sorry. Then she cut. The scalpel sliced through skin, through muscle, following the line of the ribs. Blood welled up immediately, but she didn't stop, couldn't stop. Marcus screamed, his body arcing off the table. Hold him, Evelyn barked. They held. She went deeper, cutting through the intercostal muscles, opening the chest cavity. Blood poured out. Too much blood. She grabbed the rib spreaders, fit them into place, and cranked. The ribs spread with a sound like breaking wood. Someone behind her gagged. Evelyn ignored it. She could see the lung now, deflated and torn, could see the rebar embedded deep, and she could see the subclavian artery, nicked, bleeding, not severed, but close. Clamp, she said, her voice flat. A nurse handed it to her. Evelyn reached into the chest cavity, her hands moving carefully, precisely, and clamped the artery above the tear. The bleeding slowed. Suction. Another nurse moved in with the suction catheter, clearing the blood so Evelyn could see. Okay. Evelyn's voice was calm now, controlled. I need to stabilize the rebar before we can move him. If it shifts even a centimeter, it's over. Hand me the gauze. They worked together, packing the wound, stabilizing the foreign object. Marcus had stopped screaming. He was unconscious now, his body limp. Evelyn checked his pulse. Weak, thready, but there. Get him to surgery, she said quietly. Now. Dr. Voss nodded, her face pale. Okay. They wheeled him out. Evelyn stepped back from the table, her hands covered in blood. Her scrubs, no, not her scrubs, she was still wearing her janitor's uniform, soaked through. She looked down at herself, at the blood, at her hands, and she started shaking. Commander Keller? She turned. A nurse stood in the doorway, young, barely out of school. There's another patient, red tag, severe abdominal trauma. Dr. Voss says she needs you. Evelyn closed her eyes, took a breath, opened them again. Show me. Yeah. The next 3 hours were a blur of blood and chaos and impossible decisions. Evelyn moved from patient to patient, doing things she'd sworn she'd never do again. Emergency cricothyrotomy on a teenager whose airway was crushed, pericardiocentesis on a woman with cardiac tamponade, clamshell thoracotomy on a man whose heart had stopped. She worked alongside Dr. Voss, alongside the residents, alongside nurses who looked at her like she was some kind of ghost. And maybe she was, because the woman mopping floors was gone. In her place was someone else, someone harder, colder, someone who'd spent 13 deployments keeping people alive in places where death was always one step behind. By the time the last patient was stable, the sun was fully up outside. Evelyn stood in the hallway, covered in blood, her hands shaking, her body running on fumes. Dr. Voss approached, looking just as exhausted. 6 patients, 6, and we saved all of them. Evelyn didn't respond. That doesn't happen, Voss continued, her voice quiet. Not with injuries like that. The survival rate for a mass casualty event like this is maybe 60% if we're lucky. We just hit 100. Evelyn leaned against the wall. Because of you. Don't. I'm serious. I've been doing this for 15 years, and I've never seen anyone work like that. The way you moved, the way you made decisions, the way you just knew what to do. That thoracotomy? I've seen attendings freeze up trying to do that in a controlled OR. You did it in an ER with no anesthesia and a patient who was 30 seconds from bleeding out. Evelyn closed her eyes. I need to go. No. Voss stepped in front of her. You need to tell me who you are. I told you nobody. Bullshit. Voss's voice was hard now. That soldier called you commander. He said you saved his life in Kandahar. So I'm going to ask you one more time. Who are you? Evelyn looked at her. For a long moment, neither of them spoke. Then Evelyn said, very quietly, someone who doesn't do this anymore. She pushed past Voss and walked away. Behind her, she could hear Voss calling her name, but she didn't stop. She couldn't. Because if she stopped, she'd have to face what she'd just done. And if she faced it, she'd have to admit that maybe, just maybe, she'd never really left at all. Evelyn made it to the locker room before she broke. She slumped against the wall, her breath coming in ragged gasps, her vision swimming. 3 hours. 3 hours, and she'd slipped right back into it like she'd never left. Like the last 3 months of hiding, of running, of trying to forget had never happened. She looked down at her hands, still shaking, still covered in blood. She turned on the sink, scrubbed them raw, watched the water run red. It didn't help. It never helped. The door opened. She didn't turn around. "I looked you up," Dr. Voss's voice. Evelyn kept scrubbing. "Commander Evelyn Keller, 13 deployments, 8 years in combat trauma surgery, 96% survival rate in field conditions, creator of the Keller Protocol for mass casualty triage, now standard training for every military medic in the U.S. Army." Evelyn turned off the water. "You were a legend," Voss continued. "The articles I found, the interviews. They called you the best battlefield surgeon in a generation." Evelyn dried her hands on a paper towel, her movements mechanical. "So what the hell are you doing mopping floors in a community hospital?" Evelyn finally turned around. Voss stood in the doorway, arms crossed, her expression unreadable. "I walked away," Evelyn said quietly. "Why?" "Because I couldn't save them all." Voss frowned. "Nobody can save them all." "I know." Evelyn's voice cracked, just a little. "But I tried. For 8 years I tried. And then one day I couldn't anymore." She sat down on the bench, suddenly exhausted. "There was a kid," she said quietly. 19 years old, IED took out his convoy. By the time they got him to me, he'd already lost too much blood. I did everything, but it wasn't enough." Voss said nothing. "He looked at me," Evelyn continued, her voice barely above a whisper, "right before he died. And he said, 'You promised.'" She closed her eyes. "I'd told him he was going to be okay. I'd promised him. And then I watched him die." The room was silent. "So I left," Evelyn said, "because I couldn't do it anymore. I couldn't make those promises. I couldn't carry that weight." Voss stepped closer. "So you became a janitor?" "So I became invisible. And how's that working out for you?" Evelyn looked up, her eyes hard. "It was working fine until tonight." "Was it?" Voss sat down beside her. "Because from where I'm standing, it looks like you're still carrying that weight. You just decided to carry it alone." Evelyn didn't respond. Voss sighed. "Look, I don't know what you've been through. I can't imagine. But what I saw tonight, that wasn't someone who's done. That was someone who's still fighting." "I'm not fighting anything." "Bullshit. You walked back into that ER. You saved 6 lives. You did things I've seen senior surgeons refuse to do. And you did it because you couldn't walk away, not when people needed you." Evelyn stood. "I need to go." "They're going to ask questions," Voss said. "The hospital administration, the patients, the staff. That soldier's going to wake up and tell everyone who you are. Then I'll be gone before they do. Running again. Surviving." Voss stood too, her expression hard. "You know what I think? I think you're scared. Not of failing. You're scared of succeeding, because if you succeed, you have to keep going. And if you keep going, you might lose someone again." Evelyn's jaw tightened. "But here's the thing," Voss continued. "You're going to lose people. That's the job. But you're also going to save people. And tonight, you saved 6. 6 people who are alive right now because you didn't walk away." Evelyn looked at her. "So you can run," Voss said quietly. "Or you can stay. Your choice." She turned and walked out, leaving Evelyn alone in the locker room. Evelyn stood there for a long time, staring at the blood still staining her clothes. Then she grabbed her coat and walked out. The sun was fully up now, the sky bright and clear. Evelyn stood outside the hospital, breathing in the cold morning air. She could leave, right now. Walk to the bus stop, get on, and never come back. Find another hospital, another city, another identity. She'd done it before. She could do it again. Behind her, the automatic doors slid open. "Commander Keller?" She turned. A man stood there, leaning on a crutch, his abdomen wrapped in bandages. The soldier. He looked better now, color in his face, eyes clear. "I'm sorry," he said. "I didn't mean to blow your cover or whatever. I saw you, and I had to say something." Evelyn said nothing. "You saved my life," he continued, "in Kandahar. I was in that transport when it hit the IED. I was bleeding out, and you pulled me out. You kept me talking. You told me about your hometown, about the diner you used to work at, about the worst date you ever went on. Stupid stuff. But it kept me awake. It kept me alive." Evelyn's throat tightened. "I never got to thank you," he said quietly. "So, thank you." He saluted. Evelyn stared at him. Then, slowly, she returned the salute. He smiled, nodded, and turned to go back inside. "Wait." He stopped. "What's your name?" Evelyn asked. "Davis, Corporal James Davis. How long have you been back stateside?" 2 years. "And you're doing okay?" Davis hesitated. "Some days are better than others, but I'm here, and that's because of you." Evelyn nodded slowly. Davis went back inside. Evelyn stood there, staring at the hospital, at the place she'd been hiding for 3 months, at the place that had just dragged her back into the life she'd tried to leave behind. She took a breath and turned to leave. Then she heard it. Sirens. Again. Closer this time. An ambulance screeched into the bay, lights flashing. The doors flew open and a paramedic jumped out, shouting, "GSW, to the chest! Pulse is thready! We're losing him!" Evelyn froze. The gurney rushed past her into the ER. She could hear the chaos starting again, could hear Dr. Voss shouting orders, could hear the alarms. She closed her eyes, heard that voice again. "Don't let me die." She opened her eyes and walked back inside. The ER smelled like copper and antiseptic when Evelyn pushed through the doors. The gunshot victim was already on a gurney, 2 residents working compressions while a nurse tried to get a line in. Blood pooled on the floor beneath them, spreading fast. "I need ONEG, 4 units." Dr. Voss was already gowned up, her hands moving quick. "And get me a chest tube kit." Evelyn moved without thinking. She grabbed gloves from the wall dispenser, snapped them on, and stepped up to the table. Voss saw her and didn't hesitate. "Entry wound upper right chest. No exit. Tracheal deviation, distended jugular. I'm thinking..." "Hemothorax," Evelyn finished. "He's drowning in his own blood." She pressed her fingers against the man's neck, felt the pulse. Weak, irregular. His lips were blue, his breathing shallow and wet. "Tube's not going to be enough," Evelyn said. "We need to crack him." The resident doing compressions looked up, his eyes wide. "You mean open his chest? Here? You got a better idea?" The kid opened his mouth, closed it. Voss was already moving. "Get me a thoracotomy tray. Now." A nurse ran. Evelyn looked down at the patient. Mid-20s, athletic build, wedding ring on his left hand. Someone was waiting for him somewhere. She pushed the thought away. "What's his pressure?" she asked. 60/40 and dropping, a nurse called out. "He's circling the drain." Evelyn positioned herself at the man's side. "We've got maybe 2 minutes." The nurse returned with the tray. Evelyn grabbed the scalpel, didn't wait for permission, and cut. The blade sliced clean through skin and muscle. Blood welled immediately, dark and thick. Behind her, she heard one of the residents gag. "If you're going to puke, do it in the corner," she said flatly. "I need this space clear." She grabbed the rib spreaders, fit them between the ribs, and cranked hard. The chest opened with a wet crack. There. The right lung was collapsed, deflated like a punctured balloon, and the chest cavity was full of blood. At least a liter, maybe more. "Suction," she said. Voss handed her the catheter and Evelyn cleared the cavity, watching the blood drain away. Then she saw the problem. The bullet had nicked the pulmonary artery. Small tear, but enough. Blood was pumping out with every heartbeat. "Clamp," Evelyn said. Voss slapped it into her hand. Evelyn reached in, her fingers slick with blood, and clamped the artery above the tear. The bleeding slowed. "Okay." She took a breath, forcing her hands to stay steady. "I need a vascular suture kit, and I need it 30 seconds ago." A nurse sprinted out of the room. Evelyn kept pressure on the clamp, watching the monitor. The man's pulse was stabilizing, but barely. They were running out of time. The nurse came back, handed her the kit. Evelyn threaded the needle, her movements precise despite the adrenaline screaming through her system. She'd done this before. 100 times. But never like this. Never where it felt like the whole world was watching. She started suturing, each stitch careful and deliberate. The artery was fragile, damaged. One wrong move, and it would tear completely. Around her, the room was silent, except for the beep of the monitor and the hiss of the ventilator. She finished the last stitch, tied it off, and released the clamp. The artery held. No bleeding. She let out a breath she didn't know she'd been holding. "Get him to surgery," she said quietly. "They need to repair the lung and close him up properly." Voss nodded, already signaling to the nurses. "You heard her. Let's move." They wheeled him out. Evelyn stepped back, pulling off her gloves. Her hands were shaking again. Voss came up beside her. "That's 2 thoracotomies in 6 hours." "Yeah. Most surgeons go their whole careers without doing one." Evelyn didn't respond. "You're not leaving, are you?" Voss asked quietly. Evelyn looked at her. "I don't know." "Fair enough." Voss pulled off her own gloves, tossed them in the bin. "But for what it's worth, I'm glad you came back." She walked away, leaving Evelyn standing alone in the trauma bay. Evelyn looked down at herself, covered in blood again. Scrubs, borrowed scrubs this time, soaked through. She needed to get out of here. She needed to think. But before she could move, a voice called out from the hallway. "Excuse me, are you Commander Keller?" Evelyn turned. A woman stood there, early 30s, professional suit, tablet in hand. She had the look of someone who worked in administration, polished, efficient, completely out of place in the chaos of the ER. "I'm sorry, who are you?" Evelyn asked. "Miranda Grant. I'm with hospital administration." The woman extended a hand, which Evelyn didn't take. "I need to speak with you about what happened this morning." Evelyn's stomach sank. "I'm not on staff here." "I'm aware. That's actually what I need to discuss." Miranda's smile was professional, almost too perfect. "Would you mind coming to my office? I'm kind of in the middle of... It'll only take a few minutes." It wasn't a request. Evelyn followed her down the hallway, through a set of double doors, and into the administrative wing. The contrast was jarring, quiet, carpeted floors, abstract art on the walls, nothing like the chaos she'd just left behind. Miranda's office was on the 3rd floor, a corner room with windows overlooking the parking lot. She gestured to a chair, and Evelyn sat, feeling suddenly exposed in her blood-stained scrubs. Miranda closed the door, sat behind her desk, and opened a file on her tablet. "So," she said, her tone carefully neutral, "I've been reviewing the incident reports from this morning. 6 critical patients from the building collapse. Survival rate 100%. That's unprecedented." Evelyn said nothing. "I also have reports that you performed 2 emergency thoracotomies in the ER without prior authorization. One on a construction worker, one on a gunshot victim." Miranda looked up. "Is that accurate?" "They were dying." "I understand, but you're not credentialed at this hospital. In fact, according to our records, you're employed as a custodial worker." "That's right." "So you can see the problem." Evelyn leaned forward. "The problem is that 6 people would have died this morning if I hadn't stepped in." "That's the problem." Miranda's expression didn't change. "From a legal standpoint, the hospital is liable for any procedures performed by uncredentialed personnel. If something had gone wrong, but it didn't. But it could have, what?" Miranda set down her tablet. "Look, I'm not here to argue with you. From what I understand, you saved lives this morning. And Dr. Voss has been singing your praises for the last hour, but I have a hospital to protect, and right now you're a liability." Evelyn stood. "Then I'll leave." "Wait." Miranda held up a hand. "I'm not saying you need to leave. I'm saying we need to find a solution." Evelyn sat back down slowly. "Dr. Voss tells me you have extensive trauma experience. Military background. She also mentioned something about a 96% survival rate in field conditions." "Where is this going?" Miranda pulled up something on her tablet, turned it around so Evelyn could see. It was a job posting. "Trauma surgeon, full-time position. We've been trying to fill it for 6 months. The last 3 candidates turned us down because Riverside General is too small, too far from the city, not prestigious enough. Miranda's voice was dry. But you're already here, and from what I saw this morning, you're more than qualified. Evelyn stared at the screen. I can fast-track your credentialing, Miranda continued. Get your medical license reinstated, process the paperwork, have you on staff within a week. I don't have a medical license anymore. You let it lapse. That's different from losing it. We can fix that. Evelyn shook her head. I can't do this. Can't or won't. Does it matter? Miranda leaned back in her chair. I've worked in hospital administration for 12 years. And in that time, I've learned that the best doctors aren't the ones who went to the best schools or had the best recommendations. They're the ones who can't walk away, the ones who see someone dying and have to do something about it. She paused. You walked back into that ER this morning, twice. You didn't have to, but you did. Evelyn looked away. Think about it, Miranda said quietly. Take the day. Come back tomorrow and give me an answer. Evelyn stood. I need to go. Commander Keller? She stopped at the door. For what it's worth, Miranda said, I hope you stay. Evelyn walked out without answering. She made it to the locker room, changed out of the scrubs, and put her custodial uniform back on. The fabric felt wrong now. Too loose, like wearing someone else's clothes. She grabbed her coat, her bag, and headed for the exit. The ER was calmer now. The chaos from earlier had settled into the usual rhythm. A few patients in the waiting room, a kid getting stitches, an elderly woman hooked up to an EKG. Normal. Evelyn pushed through the doors, stepped outside, and stopped. A crowd had gathered in the parking lot. At least 20 people, maybe more. Patients from the building collapse. Family members. A few nurses and residents. And standing at the front was Marcus, the construction worker with the rebar through his chest. He was in a wheelchair, bandaged and pale, but alive. He saw her and raised his hand. There she is. Everyone turned. Evelyn froze. Thank you, Marcus said, his voice rough but clear. You saved my life. The woman next to him, his wife, Evelyn guessed, was crying. You brought him back to us. One of the other patients stepped forward. You saved me too. The doctor said if you hadn't done that thing with the needle, I would have died before they could get me to surgery. We just wanted to say thank you, another voice called out. Evelyn stood there speechless. She didn't know what to say, didn't know what to do. So she nodded, turned, and walked toward the bus stop. Behind her, she could hear them talking, their voices fading as she got farther away. But the words stayed with her. Thank you. You saved my life. She sat at the bus stop, waiting, staring at the ground. Her phone buzzed. A text from a number she didn't recognize. This is Dr. Voss. Miranda told me about the job offer. I know you're not sure, but if you want to talk, I'm here. No pressure. Evelyn stared at the message, then she turned off her phone. The bus pulled up. The doors hissed open. She didn't get on. She just sat there, watching it drive away. That night, Evelyn couldn't sleep. She lay in her tiny studio apartment, staring at the ceiling, her mind racing. She kept seeing their faces. The soldier, Marcus, the gunshot victim, all the people she'd saved, all the people she might save if she stayed, and the ones she couldn't. The 19-year-old kid who'd died in her arms in Kandahar, the transport driver who'd bled out before she could get to him, the civilian girl caught in crossfire, her eyes empty by the time Evelyn reached her. She closed her eyes, but the images didn't stop. At 2 a.m, she gave up trying to sleep. She got dressed, grabbed her coat, and walked. The city was quiet at this hour. Empty streets, streetlights casting long shadows. She walked without direction, without purpose, just moving. She ended up at a park a few blocks from the hospital. There was a bench overlooking a small pond, and she sat down, pulling her coat tight against the cold. Her phone buzzed again. Another text from Dr. Voss. Can't sleep either. There's coffee in the ER break room if you want to talk. Evelyn stared at the message for a long time. Then she stood up and started walking. Gate. The ER was quiet when she arrived. Just a few patients, a couple of nurses at the station. Dr. Voss sat in the break room, a cup of coffee in front of her, looking exhausted. She looked up when Evelyn walked in. Couldn't stay away? Couldn't sleep. Voss gestured to the chair across from her. Join the club. Evelyn sat. Voss poured her a cup of coffee from the pot on the counter, slid it across the table. They sat in silence for a moment. I keep thinking about that kid, Voss said quietly. The one with the crushed pelvis. He's 17, just started his senior year. He was working construction to help pay for college. Evelyn wrapped her hands around the cup, feeling the warmth. If you hadn't been here, Voss continued, he would have died. No question. But you triaged him, tagged him red, made sure he got to surgery in time. And now he's going to walk again. Maybe not perfectly, but he'll walk. She took a sip of her coffee. I've been doing this for 15 years, she said, and I've never had a day like today. Never seen anything like what you did. Evelyn looked at her. It's not always like that. Sometimes you do everything right and they still die. I know. Then you know why I can't do this. I know why you think you can't. Voss leaned forward. But I also know you already are doing it. You came back this morning. You came back tonight. You can't help yourself. Evelyn didn't respond. I get it, Voss said. I really do. The weight of it, the responsibility. Knowing that every decision you make could mean the difference between someone living or dying. It's crushing. And some days you're going to lose. Some days you're going to do everything right and it still won't be enough. She paused. But some days you're going to save 6 people. And they're going to go home to their families. And that has to count for something. Evelyn stared into her coffee. What if it's not enough? Then it's not. But you still showed up. They sat in silence again. Then Voss's pager went off. She looked at it, sighed. Trauma incoming. You want to... No. Voss stood. Okay. But if you change your mind, you know where to find me. She left. Evelyn sat alone in the break room, listening to the sounds of the ER outside. Voices, alarms, footsteps, the sounds of people trying to save lives. She finished her coffee, stood, and walked to the door. Stopped. Turned back. Looked at the hallway leading to the trauma bays. She could leave right now, walk out, never come back, find another city, another job, another life. Or she could stay. She took a breath and walked toward the trauma bay. The patient was already on the table when she arrived. Young woman, early 20s, car accident, chest trauma. Dr. Voss and 2 residents were working on her, but something was wrong. The monitors were screaming and Voss's face was tight. What have we got? Evelyn asked, stepping up. Voss looked at her, surprise flickering across her face. Flail chest, multiple rib fractures. She's not ventilating properly. Evelyn looked at the monitor. Oxygen saturation dropping. 78%. 75. She needs to be intubated, one of the residents said. We tried. Her airway's too swollen. Then we need to do a crick, Evelyn said. Voss handed her the kit without a word. Evelyn positioned herself at the woman's neck, felt for the cricothyroid membrane, and made the incision. Fast and clean. She inserted the tube, secured it, and connected the bag. The woman's oxygen saturation started climbing. 80, 85, 90. Evelyn stepped back. Voss looked at her. You're staying. It wasn't a question. Evelyn pulled off her gloves. For tonight. I'll take it. They worked together for the next hour, stabilizing the patient, getting her ready for surgery. When it was done, Evelyn found herself in the break room again, this time with Voss and the 2 residents. One of them, a young guy with glasses, couldn't have been more than 26, looked at her nervously. Can I ask you something? Sure. How do you do it? Stay calm, I mean, when everything's falling apart. Evelyn thought about it. You don't. You just move anyway. The kid frowned. But you seem so... controlled. That's the training. But inside? She shrugged. I'm panicking just like everyone else. I've just learned to keep moving through it. The other resident spoke up. A woman with dark hair pulled back in a tight ponytail. Is it true you did 13 deployments? Yeah. Why'd you leave? Evelyn hesitated. Because I was tired of carrying bodies. The room went quiet. Voss cleared her throat. Okay, you 2, go check on the patient in Bay 3. I'll catch up. They left. Voss looked at Evelyn. You didn't have to answer that. It's fine. They deserve to know what they're getting into. And what are they getting into? Evelyn leaned back in her chair. A job that's going to break them if they let it. A job that's going to ask them to make impossible decisions and live with the consequences. A job that's going to save lives and take pieces of them in return. Voss nodded slowly. Yeah, that sounds about right. You ever think about quitting? Every day. Voss smiled, but it didn't reach her eyes. But then someone comes through those doors and I can't walk away. Same. They sat in silence for a moment. Then Voss said, Miranda's serious about the job offer, you know. She can have you credentialed by the end of the week. I know. So? Evelyn stood. I need to think about it. Fair enough. But Keller... She stopped at the door. We need you here, Voss said quietly. I need you here. Evelyn didn't answer. She just walked out. The next 2 days passed in a blur. Evelyn kept working her custodial shifts, but she couldn't stay away from the ER. Every time an ambulance pulled up, she found herself drifting toward the trauma bays, watching, waiting. And when Voss needed her, which was more often than not, she stepped in. Another thoracotomy, a field amputation, a pericardiocentesis that saved a man's life by seconds. Word spread fast. Within 48 hours, everyone in the hospital knew who she was. The residents started asking her questions. The nurses brought her coffee. Patients asked for her by name. And Miranda Grant called her into her office again. Your paperwork's almost done, Miranda said, handing her a folder. Medical license reinstatement, hospital credentialing, background check, all of it. Evelyn looked at the folder but didn't open it. There's one more thing, Miranda continued. She pulled out another document. A contract, full-time trauma surgeon, competitive salary, benefits, the works. She slid it across the desk. Evelyn stared at it. All you have to do is sign, Miranda said. Evelyn picked up the pen, held it over the line. Her hand was shaking. She put the pen down. I can't. Miranda's expression didn't change. Why not? Because the last time I signed something like this, I promised to save lives, and I failed. You're failing right now by walking away. That's not fair. No, it's not. Miranda leaned forward. But it's true. You have a gift, Commander Keller, and you're wasting it because you're scared. Evelyn stood. I'm not scared. Then what are you? She didn't have an answer. She walked out, leaving the contract unsigned on the desk. That night, she was in the supply closet, restocking gloves, when the alarms went off. Not just one, all of them. The intercom crackled to life. Code Black, repeat Code Black, all personnel to the ER, active shooter situation, multiple casualties inbound. Evelyn's blood went cold. She dropped the box of gloves and ran. The ER was already in chaos when she arrived. Security was locking down the entrances. Nurses were ushering patients into rooms. Doctor. Voss stood in the middle of it all, shouting orders. How many? Evelyn asked, running up. Unknown. Shooting at a shopping mall 2 miles away. First ambulance is 30 seconds out. The doors burst open. A paramedic jumped out, his uniform covered in blood. We've got 8 critical. Gunshot wounds to the chest, abdomen, extremities. More coming. Evelyn's training kicked in instantly. Clear the trauma bays, set up triage in the hallway. Get me every available surgeon in this building. Now! Voss didn't question it. She just started barking orders. The first gurney crashed through the doors. A teenage girl. Gunshot wound to the abdomen. Screaming. Evelyn grabbed the gurney, wheeled her to Bay 1. Talk to me. What's your name? Sarah. Okay, Sarah. I'm going to help you, but I need you to stay calm. She cut away the girl's shirt, assessed the wound, entry just below the ribs. No exit. Pressure's dropping, a nurse called out. Internal bleeding. Get me to surgery, Evelyn said. Now. They wheeled her out. The next gurney came in. Then another. Then another. 8 patients, all critical. Evelyn moved between them, triaging, assessing, making split-second decisions. Red tag, yellow tag, red tag. The ER was drowning in blood and chaos, and there weren't enough hands. I need help, a resident shouted from Bay 3. He's coding. Evelyn ran over. Middle-aged man, gunshot to the chest. Flatline on the monitor. She started compressions, hard and fast. Get me the thoracotomy kit, she said. We don't have time. The resident started. Now! He grabbed it. Evelyn cut into the man's chest, spread the ribs, and reached inside. His heart wasn't beating. She squeezed it manually, forcing blood through his system. Once, twice, 3 times. The monitor beeped. A pulse. Get him to surgery, she said. She moved to the next patient, and the next, and the next. For 2 hours she worked without stopping, without thinking. Just moving from one crisis to the next, doing whatever it took to keep people alive. When it was finally over, when the last patient was stabilized and wheeled to surgery, Evelyn stood in the middle of the ER, covered in blood, her entire body shaking. 8 patients, 7 saved, 1 lost, a young man, early 20s, gunshot wound to the head. He'd died before they could even get him on the table. Evelyn stared at the empty gurney where he'd been, at the blood pooling on the floor, at the sheet covering his body. Voss appeared beside her. You did everything you could. It wasn't enough. It never is. Voss's voice was quiet. But you saved 7. That has to count. Evelyn turned and walked away. She made it to the locker room, collapsed onto the bench, and put her head in her hands. The door opened. Miranda Grant stepped inside. I heard what happened, she said quietly. Evelyn didn't look up. 7 out of 8, Miranda continued. That's an 87% survival rate for a mass shooting event. The national average is less than 50%. I lost one. You saved 7. Evelyn looked up, her eyes red. It's not enough. Miranda sat down beside her. It has to be. Because if it's not, then what's the point? She pulled out the contract from her bag, set it on the bench between them. You can keep running, Miranda said. Keep hiding. Keep telling yourself you're not good enough. Or you can sign this and save the next 7, your choice. She stood and walked out, leaving the contract behind. Evelyn stared at it for a long time. Then she picked up the pen, and the door burst open. A security guard, out of breath. Dr. Keller, we need you. There's been an explosion at a chemical plant, multiple casualties. They're saying it's bad. Really bad. Evelyn looked at him, at the contract in her hand, at the pen. Outside, sirens wailed. She dropped both on the bench and ran. The chemical plant was 7 miles outside the city, and Evelyn could see the smoke from the hospital parking lot. Black, thick, rising into the sky like a pillar. She didn't wait for an ambulance. She grabbed Dr. Voss, 2 residents, and a nurse, threw them in her car, and drove. The roads were clogged with emergency vehicles heading the same direction. Fire trucks, hazmat teams, police cruisers with lights blazing. Evelyn weaved through traffic, her hands tight on the wheel, her mind already running through protocols she hadn't used in years. Chemical exposure, burns, inhalation injuries, blast trauma. This was going to be bad. What kind of plant was it? Voss asked from the passenger seat. Industrial solvents, one of the residents said, reading from his phone. Acetone, benzene, toluene. If those tanks ruptured, then we're dealing with chemical burns and respiratory distress, Evelyn finished. Possibly toxic inhalation. We need to set up decon before anyone gets near the ER. Voss pulled out her phone, started making calls. I'm contacting hazmat. We'll need barriers, containment protocols, the works. They arrived at the scene 10 minutes later. It was worse than Evelyn had imagined. The plant was a sprawling complex of warehouses and storage tanks, and half of it was on fire. Flames licked up the sides of buildings, fed by chemicals that burned too hot and too bright. Smoke poured from shattered windows. And in the parking lot, dozens of workers lay on the ground, some screaming, some silent. Evelyn parked as close as she could, jumped out, and ran toward the command center, a cluster of fire trucks where incident commanders were coordinating the response. A fire captain saw her coming. Who the hell are you? Trauma surgeon from Riverside General. How many casualties? At least 40, maybe more inside. Evelyn's stomach dropped. Inside? You mean there are still people in there? We can't get to them. The structure's unstable, and we've got chemical fires on 3 floors. We're waiting for specialized equipment. How long? 20 minutes. Maybe longer. 20 minutes. People would be dead by then. Evelyn turned to Voss. We need to triage out here. Set up a field hospital. Use the ambulances as treatment areas. Voss nodded, already moving. I'm on it. Evelyn grabbed the two residents. You're with me. We're going to assess every patient in that parking lot and get the critical ones transported first. They ran. The scene was chaos. Workers lay scattered across the pavement, some burned, some bleeding, some just sitting in shock. The smell was overwhelming, chemicals, smoke, burnt flesh. Evelyn dropped to her knees beside the first patient. A man in his 40s, his face blistered and red. Chemical burns across his chest and arms. Can you hear me? She asked. He nodded, his breath coming in short gasps. Okay, we're going to get you out of here. She turned to one of the residents. Tag him yellow, get him on oxygen, and start an IV. Rinse the burns with saline, but don't use anything else until we know what chemical we're dealing with. She moved to the next patient. A woman, younger, unconscious. Evelyn checked her airway. Clear. Breathing, shallow, pulse, weak, red tag. Get her on a gurney now, Evelyn shouted. She needs to be transported immediately. She kept moving, tagging, sorting, making decisions. Red, yellow, red, green, black. The black tags were the hardest. A young man, early 20s, lying face down. No pulse, no breathing. Burns covering 80% of his body. Evelyn placed the tag on his wrist and moved on. There wasn't time to grieve. Behind her, Voss had set up a makeshift treatment area using the back of an ambulance. She was directing the residents, organizing supplies, coordinating with the paramedics. Evelyn worked her way through the parking lot, assessing every patient she could find. By the time she'd finished, she'd tagged 32 people. 14 red, 12 yellow, 4 green, 2 black. But that left 8 unaccounted for. The ones still inside. She stood up, looking at the burning building. The fire captain appeared beside her. You need to pull your people back. The whole structure could come down. What about the people inside? We're doing everything we can. That's not an answer. The captain's jaw tightened. We can't risk sending crews in there, not until we get the equipment. Evelyn looked at the building again. Flames poured from the windows on the second floor. Smoke billowed from the roof. 8 people. She turned and started walking toward the entrance. Hey! The captain shouted. Where the hell are you going? Inside. You can't. She kept walking. Voss caught up to her, grabbed her arm. Keller, don't. You're not equipped for this. Neither are they. You'll die in there. Maybe. Evelyn pulled her arm free. But I'm going anyway. She grabbed a respirator mask from one of the hazmat techs, pulled it on, and ran toward the building. Behind her, she could hear Voss shouting, the fire captain cursing, but she didn't stop. She hit the entrance at a full sprint. The heat slammed into her like a wall. The interior was a maze of smoke and fire. Flames crawled up the walls, fed by chemicals that shouldn't burn but did. The floor was slick with liquids Evelyn couldn't identify. The air was thick, toxic, burning her lungs even through the mask. She pulled out her phone, turned on the flashlight, and started searching. Can anyone hear me? She shouted. No response. She moved deeper into the building, checking rooms, offices, storage areas. The smoke was so thick she could barely see 2 feet in front of her. Then she heard it. A voice. Weak. Distant. Help! Evelyn followed the sound, her heart pounding. She rounded a corner and found them. 3 workers, trapped under a collapsed beam. One was unconscious. The other 2 were trying to lift the beam, but it was too heavy. Evelyn ran over, dropped to her knees. How long have you been here? 10 minutes, maybe more. The man's voice was strained, his face covered in soot. We can't move him. Evelyn assessed the situation. The beam was steel, at least 6 inches thick, and it was pinning the unconscious man's legs. Behind them, flames were spreading, eating through the walls. They had maybe 2 minutes. Okay, Evelyn said. On 3, we lift together. You pull him out. Got it? They nodded. 1, 2, 3. They lifted. The beam moved, just barely. The other man grabbed his coworker, dragged him out. Evelyn let go, and the beam crashed back down. Go, she shouted. Get out of here. They ran, half dragging the unconscious man between them. Evelyn followed, but the smoke was thicker now, disorienting. She couldn't see the exit. She turned left, hit a wall, turned right, found a hallway, kept moving. The heat was unbearable. Her skin felt like it was blistering. Her lungs screamed for air. Then she saw light. The exit. She stumbled through, collapsing onto the pavement outside. Hands grabbed her, pulled her away from the building. She ripped off the mask, gasping for air. Voss was there, her face pale. "You stupid, reckless—" "They're alive," Evelyn rasped. "3 of them." Behind them, the building groaned. A section of the roof collapsed inward, sending up a shower of sparks. The fire captain appeared, his expression somewhere between fury and respect. "You just saved 3 lives, and almost got yourself killed." Evelyn didn't respond. She was already looking at the workers she'd pulled out. The unconscious one was in bad shape, burns on his arms and face, possible spinal injury from the beam. He needed surgery, and he needed it now. "Get him on a gurney," she said, her voice hoarse. "Transport to Riverside immediately." Voss helped her stand. "You need to be checked out, too. You inhaled smoke. You could have chemical exposure." "I'm fine." "You're not fine." "I said I'm fine." Evelyn pulled away, walked back to the triage area. There were still patients to treat, still lives to save. She worked for another hour, stabilizing patients, coordinating transports, doing everything she could to keep people alive. By the time the last ambulance pulled away, the sun was setting, and Evelyn was running on nothing but adrenaline and spite. Voss found her leaning against a fire truck, her hands shaking, her face covered in soot. "We need to talk," Voss said. "Not now." "Yes, now." Voss's voice was hard. "You just ran into a burning building without backup, without proper equipment, without authorization. Do you have any idea how reckless that was?" "I saved 3 people." "You could have died." Evelyn looked at her. "But I didn't." Voss opened her mouth, closed it. Then she sighed, running a hand through her hair. "You're impossible." "Yeah." They stood in silence for a moment. Then Voss said quietly, "Miranda's going to want to talk to you when we get back." "Let her." "Keller, I'm serious. What you did tonight, running into that building, performing field triage in a disaster zone, that's not in your job description. Hell, you don't even have a job description. You're still technically a janitor." Evelyn almost laughed. "Yeah, I know." "So what are you going to do?" Evelyn looked at the building, still burning despite the fire crew's best efforts. Looked at the ambulances disappearing down the road. Looked at her hands, still shaking. "I don't know," she said quietly. Voss put a hand on her shoulder. "Well, figure it out, because people are starting to notice, and not just the staff. The media's here. I saw at least 3 news vans on the way in." Evelyn's stomach sank. "Great. Come on, let's get back to the hospital." They drove in silence, Evelyn staring out the window, watching the smoke fade into the distance. When they arrived at Riverside General, the parking lot was packed. Ambulances lined up at the bay. Reporters clustered near the entrance. Camera crews setting up shots. Evelyn pulled around to the back entrance, trying to avoid them. It didn't work. A reporter spotted her, shouted something, and suddenly they were swarming. "Is it true you ran into the burning building? How many people did you save? Are you the same Commander Keller from the military?" Evelyn pushed through them, not answering, her head down. Security cleared a path, and she made it inside. The ER was overflowing, every trauma bay filled. Patients in the hallways, nurses running between rooms. Miranda Grant stood in the center of it all, coordinating with her tablet, her expression grim. She saw Evelyn and waved her over. "My office, now." Evelyn followed her up to the administrative wing. The contrast was jarring again, quiet, calm, completely removed from the chaos below. Miranda closed the door behind them, gestured to a chair. Evelyn sat. Miranda didn't. She paced, her arms crossed. "Do you have any idea what you've done?" "Saved lives." "You've created a legal nightmare." Miranda turned to face her. "You're not credentialed. You're not authorized to perform medical procedures. And you just conducted multiple field operations in a disaster zone. If anyone had died, if you had died, this hospital would be liable for everything." Evelyn leaned back in the chair. "But nobody died." That's not the point. Then what is the point? Miranda sat down behind her desk, her expression softening slightly. The point is that you're good. Better than good. You're exceptional, but you're operating in a gray area, and that's dangerous. For you and for us. She pulled out the contract again, the one Evelyn had left unsigned. Sign this, Miranda said. Make it official. Let us credential you properly so you can do what you do without putting everyone at risk. Evelyn stared at the paper. I can't, she said again. Why not? Because the second I sign that, I'm responsible again, and I can't. Her voice cracked. I can't carry that weight anymore. Miranda was quiet for a moment. Then she said, You're already carrying it. You've been carrying it every day for 3 months. The only difference is now people can see it. Evelyn looked away. The media is calling you a hero, Miranda continued. They're running stories about the janitor who saved 40 lives, about the military surgeon who came out of hiding to help in a crisis. People are watching, Keller, and they're asking questions. I don't want to be a hero. Too late. Miranda slid the contract across the desk. You already are. Before Evelyn could respond, the door burst open. A nurse, out of breath. Dr. Keller, we need you. One of the chemical exposure patients is crashing. Evelyn stood, already moving. Wait, Miranda started. But Evelyn was gone. She ran down the stairs, through the hallway, into Trauma Bay 2. The patient was the man she'd pulled from under the beam. He was seizing, his body convulsing, foam coming from his mouth. What happened? Evelyn demanded. One of the residents looked panicked. We don't know. He was stable, and then he just started seizing. Evelyn grabbed his chart, scanned it quickly. Chemical exposure, benzene, toluene, and then she saw it. Delayed neurotoxicity. The chemicals had crossed the blood-brain barrier. He's having a toxic reaction, Evelyn said. Get me diazepam, 5 milligrams IV, now, and call neurology. We need a consult immediately. The nurse handed her the syringe. Evelyn pushed it into the IV line, watched the medication flow. The seizures slowed, stopped. The patient went limp, his breathing shallow but steady. Evelyn checked his pupils. Reactive but sluggish. He needs a CT scan, she said, and continuous monitoring. If his brain starts swelling, we'll need to intervene. Voss appeared at her shoulder. Nice catch. Yeah. Evelyn stepped back, pulling off her gloves. But he's not out of the woods yet. They wheeled him out. Evelyn stood there, her hands shaking again. Voss noticed. You need to sit down. I'm fine. You're not. You inhaled smoke, you've been exposed to chemicals, and you've been running on adrenaline for 6 hours. Sit down. Evelyn didn't argue. She sat on the edge of the gurney, her vision swimming. Voss checked her vitals, listened to her lungs. Your oxygen saturation's low. You need to be on supplemental O2. It's not a suggestion. Voss hooked her up to an oxygen tank, placed the mask over her face. Evelyn sat there, breathing, letting the world come back into focus. Around her, the ER continued its controlled chaos. Nurses moving patients, residents consulting charts, the steady rhythm of life-saving work. And for the first time in 3 months, Evelyn felt something she hadn't felt in a long time. She felt like she belonged. Voss sat down beside her. You know, for someone who says they don't want to do this anymore, you're doing a pretty terrible job of quitting. Evelyn almost smiled. Yeah. So maybe stop fighting it. Maybe. They sat in silence for a moment. Then the doors burst open again. But this time, it wasn't an ambulance. It was military. 4 soldiers in full dress uniforms walked into the ER, their boots echoing on the tile floor. At the front was a man in his 50s, stars on his shoulders. A general. Everyone stopped. The general's eyes scanned the room, then landed on Evelyn. He walked straight to her. Commander Keller, he said, his voice formal. Evelyn stood slowly, removing the oxygen mask. General? He didn't offer his hand. Instead, he looked around the ER, at the patients, at the chaos, at the blood still staining the floor. I heard you've been busy, he said. I'm not in the military anymore, sir. That's not what your record says. He pulled a folder from under his arm, handed it to her. Evelyn opened it. Her heart stopped. It was a reinstatement order. The Army wants you back, the general said. Effective immediately. There's a situation overseas, multiple casualties, field hospital, overwhelmed. They need someone with your experience. Evelyn stared at the paper. I resigned. Your resignation was never officially processed. Bureaucratic error. The general's expression didn't change. You're still on the books as active reserve, which means you're subject to recall. You can't. I can, and I am. He gestured to the soldiers behind him. You have 24 hours to report to base for deployment briefing. Evelyn's hands were shaking again. I'm not going. That's desertion, Commander. You know what the consequences are. Voss stepped forward. Wait, she's working here. She has patience. She's a soldier first. The general turned to leave. 24 hours, Commander. Don't make this difficult. He walked out, his soldiers following. The ER was silent. Evelyn stood there, the reinstatement order in her hands, her entire world collapsing around her. Voss grabbed her arm. You're not going. We'll fight this. We'll get lawyers. It doesn't matter. Evelyn's voice was hollow. He's right. I never officially resigned. I just stopped showing up. So what are you going to do? Evelyn looked at the paper, at the signature at the bottom, at the date. Tomorrow. 24 hours. She looked around the ER, at the patients she'd saved, at the staff who'd started to trust her, at the life she'd almost let herself build. And then she looked at the exit, at the door the general had just walked through, at the choice she was being forced to make. She crumpled the paper in her fist. I don't know, she said quietly. Behind her, the monitors beeped. An alarm went off in one of the trauma bays. A nurse shouted for help, and Evelyn stood frozen, caught between two worlds, unable to move in either direction. Voss's phone buzzed. She looked at it, her face going pale. Oh no. What? Voss turned the screen toward her. It was a news alert. Hero janitor revealed as disgraced military commander who abandoned her post. Below it was a photo of Evelyn from 8 years ago, in full uniform, standing beside a transport helicopter. And below that, a quote from an unnamed military source. Commander Keller walked away from her duty. She left her team, her patients, her country. And now she's playing doctor in a civilian hospital while real soldiers die overseas. Evelyn's stomach dropped. They're destroying you, Voss said quietly. Evelyn looked at the screen, at the comments already piling up, at the articles being published in real time. Coward, deserter, fraud. She handed the phone back, her hands numb. I need to go, she said. Where? I don't know. She walked toward the exit, her mind racing, her vision tunneling. Behind her, Voss called her name, but she didn't stop. She pushed through the doors, into the parking lot, into the cold night air, and standing there, waiting beside a black sedan, was the general. He looked at her, his expression unreadable. Running again, Commander? He asked. Evelyn stopped. You know, the general continued, stepping closer, I read your file. All of it. 13 deployments, 96% survival rate, medals, commendations, letters of recommendation from officers who called you the best combat surgeon they'd ever seen. He paused. And then I read the incident report from your last deployment, the one that made you walk away. Evelyn's jaw tightened. That kid who died, the general said quietly. The 19-year-old. You know what his autopsy showed? She didn't respond. Massive internal bleeding from a severed hepatic artery, injury incompatible with life. He was dead before he even hit your table. There was nothing you could have done. Evelyn's throat closed. You didn't fail him, Commander. He was already gone. Then why did I promise him he'd be okay? Her voice cracked. Because that's what we do. We lie to make them feel safe in their last moments, and then we carry the weight so they don't have to. He stepped closer. You've been punishing yourself for 8 years for something that wasn't your fault. And in the process, you've wasted one of the greatest surgical minds I've ever seen. Evelyn looked away. So here's what's going to happen, the general said. You're going to make a choice. You can get in that car, come back to the military, and spend the rest of your life saving soldiers in war zones. Or you can stay here, sign that contract, and save civilians in this hospital. And if I don't choose, then I'll make the choice for you, and you won't like it. He opened the car door. 24 hours, Commander. He got in. The car drove away. Evelyn stood alone in the parking lot, the weight of 8 years pressing down on her shoulders. Behind her, the hospital doors opened. Miranda Grant stepped out, the contract in her hand. "I heard what happened," she said quietly. Evelyn didn't turn around. "You have a choice to make," Miranda continued. "And I know it's not easy, but whatever you decide, I need you to know something." Evelyn finally looked at her. "You saved 43 lives in the last 72 hours, Miranda said. 43 people who are alive right now because you refused to walk away. So if you think you're a coward, if you think you're a deserter, if you think you don't deserve to be here, you're wrong." She held out the contract. "Sign this. Stay. Let us fight the military together because we need you here. And I think you need to be here too." Evelyn stared at the paper, at the line waiting for her signature, at the choice that would define the rest of her life. She reached for the pen, and the hospital exploded. The blast threw her to the ground, her ears ringing, her vision white. She looked up, disoriented, and saw flames pouring from the ER entrance. Smoke, screaming, people running. Miranda was on the ground beside her, blood running down her face. Evelyn crawled to her, checked her pulse. Still alive. She looked at the hospital, at the fire, at the people trapped inside, and she heard it again. That voice. "Don't let me die." Evelyn stood, her legs shaking, her ears still ringing, and she ran straight into the flames. The heat was worse than the chemical plant. Evelyn hit the ER entrance at a dead run, smoke already pouring through the shattered glass doors. The explosion had torn through the waiting room, chairs overturned, ceiling tiles collapsed, electrical wires sparking from exposed panels. The sprinkler system had activated, raining down water that did nothing to stop the flames crawling up the walls. She could hear screaming inside. She pulled her shirt over her mouth and pushed through. The waiting room was chaos. Patients scrambling toward exits. A nurse pinned under a fallen beam. An elderly man collapsed near the reception desk, not moving. Evelyn grabbed the nurse first. The beam was lighter than the one at the chemical plant, but it had her trapped at the waist. "Can you feel your legs?" Evelyn shouted over the roar of the fire. "Yes, I can feel them." "Then help me lift. On 3. They counted together, lifted, and the nurse scrambled free. Evelyn pointed toward the exit. "Go! Get outside!" The nurse ran. Evelyn moved to the elderly man, checked for a pulse. Still there. Weak, but there. She grabbed him under the arms, dragged him toward the doors, and handed him off to a paramedic who'd appeared in the smoke. "How many more inside?" the paramedic shouted. "I don't know." She went back in. The smoke was thicker now, black and toxic. The fire had spread to the nurses' station, consuming paper charts and computer monitors. Flames licked across the ceiling, fed by acoustic tiles and insulation. Evelyn moved deeper, checking rooms. Exam 1, empty. Exam 2, a patient unconscious on the gurney, oxygen mask still on his face. She grabbed the gurney, wheeled it toward the exit, and a firefighter took over. Exam 3, clear. Trauma Bay 1, locked. She kicked the door open. Dr. Voss was inside, trying to move a patient on a ventilator. The patient was sedated, intubated, completely dependent on the machine keeping him alive. "We can't move him," Voss shouted. "The vent's plugged into the wall." Evelyn looked at the setup. The ventilator was hardwired into the hospital's electrical system, not battery-powered. If they unplugged it, the patient would stop breathing. "We have to bag him manually," Evelyn said. "For how long?" "As long as it takes." She grabbed the bag valve mask from the crash cart, disconnected the ventilator tubing, and started squeezing. 1 breath every 5 seconds. Voss grabbed the foot of the gurney, and together they wheeled him out. The hallway was an inferno now. Flames blocked the main exit. "Back door!" Evelyn shouted. They reversed direction, moving fast. Evelyn still bagging the patient with one hand while steering the gurney with the other. Her lungs burned, her eyes watered, every breath tasted like ash. They hit the back exit, burst through into the parking lot, and a team of paramedics swarmed them. "Get him on a transport vent now," Voss ordered. They moved. Evelyn doubled over coughing, her chest on fire. Voss grabbed her shoulder. "You need oxygen." "I'm fine." "You're not—" "Is everyone out?" Evelyn cut her off. Voss looked around, doing a mental head count. "I think so. I don't know." Evelyn straightened, looked back at the building. The ER was fully engulfed now, flames pouring from the windows. Fire crews were setting up, but it was too late to save the wing. Miranda appeared beside them, a bandage wrapped around her head, her suit torn and bloody. "Is everyone accounted for?" "We're still doing a count," Voss said. One of the security guards ran up, tablet in hand. "I've got the log. 23 patients were checked in. We've evacuated 22. Evelyn's stomach dropped. "Where's the last one?" The guard checked his screen. "Trauma Bay 3. Critical patient. Post-op from the chemical plant. The man who'd been seizing. The one Evelyn had stabilized an hour ago." "He can't be moved," Voss said, her face pale. "He's on continuous neuromonitoring. If we disconnect him—" "Then we don't disconnect him," Evelyn said. "We move him with everything attached. The bay's in the center of the ER. The fire's already there. Then we go through it." "Keller?" Evelyn was already moving. She grabbed a firefighter. "I need gear. Mask, gloves, coat. Now." The firefighter hesitated, then grabbed a spare set from the truck. Evelyn pulled it on, the coat too big, the mask not fitting right. She didn't care. She ran back toward the building. Behind her, Voss screamed her name. She didn't stop. The ER was worse than before. The ceiling was collapsing, raining down debris and burning insulation. The heat was unbearable, even through the coat. Evelyn kept her head down, moving fast, following the route she'd memorized. Trauma Bay 3 was in the back corner, past the nurses' station, through a hallway now completely on fire. She ran through it, her coat smoldering, her boots melting on the superheated floor. The door to the bay was closed. She kicked it open. The patient was still there, unconscious, monitors beeping, IVs running. The neuromonitor showed steady brain activity. He was stable. For now. Evelyn grabbed the gurney, started wheeling it toward the door, and the ceiling collapsed behind her. Debris crashed down, blocking the hallway. Flames roared up, cutting off her exit. She spun around, looking for another way out. There. A window. Small, high on the wall, but big enough. She grabbed a chair, smashed the glass, and started disconnecting the patient's equipment. The neuromonitor went into alarm mode. The IV pumps beeped warnings. But she couldn't take them with her. She grabbed the bag valve mask, disconnected the ventilator, and started bagging. Then she looked at the window, at the patient, at the impossibility of getting him through. She pulled out her phone, dialed 911. "This is Commander Evelyn Keller. I'm trapped in Trauma Bay 3 at Riverside General with a critical patient. We need extraction through the west side window. Now!" She hung up. 30 seconds later, she heard it, a ladder hitting the wall outside. A firefighter appeared in the window. "Hand him up!" Evelyn grabbed the patient under the arms, lifted him as high as she could. The firefighter reached down, grabbed him, and pulled him through. "Your turn!" the firefighter shouted. Evelyn grabbed the windowsill, hauled herself up, and the floor gave way beneath her. She dropped, caught the edge of the window with one hand, her legs dangling over open air and fire below. The firefighter grabbed her wrist. "I got you!" He pulled. Evelyn scrambled, her boots scraping against the wall, and then she was through, falling onto the ladder, gasping for air. The firefighter helped her down. She hit the ground, ripped off the mask, and vomited smoke and ash. Voss was there, shouting something Evelyn couldn't hear over the ringing in her ears. Paramedics swarmed the patient, loading him into an ambulance. Evelyn sat on the curb, her head between her knees, her entire body shaking. Miranda appeared, crouched beside her. "That was the stupidest thing I've ever seen." Evelyn looked up. "He's alive, isn't he?" "Barely. So are you." They sat in silence, watching the ER burn. Fire crews had given up on saving it. They were just containing it now, keeping it from spreading to the rest of the hospital. A news van pulled up. Then another. Cameras started rolling. Evelyn looked away. "They're going to want a statement," Miranda said quietly. "I don't care." "You should, because this wasn't an accident." Evelyn's head snapped up. "What?" Miranda pulled out her phone, showed her a message from the fire marshal. "Preliminary report. They found accelerant residue near the blast site. Someone set this fire deliberately." Evelyn stared at the screen. "Who would—" "I don't know. But I'm going to find out." She stood, walked toward the incident command center. Evelyn stayed on the curb, her mind racing. Someone had bombed the hospital. On the same night the military showed up to recall her. On the same night, the media started running hit pieces calling her a deserter. That wasn't coincidence. She pulled out her phone, scrolled through the news alerts. The articles were everywhere now, her face plastered across every major outlet, the story evolving in real time. Disgraced commander returns, then runs again. Military insider, Keller abandoned soldiers to play hero. Hero or fraud? The truth about the janitor surgeon. And then she saw the byline on one of them. Written by Captain Derek Hastings, U.S. Army Public Affairs. Evelyn's blood went cold. Hastings. She knew that name. He'd been stationed with her in Kandahar. A logistics officer, ambitious, always looking for his next promotion. He'd wanted a field commendation for a supply run that had gone wrong, got 3 soldiers killed. Evelyn had refused to sign off on it, filed a report instead. He'd been reassigned, and apparently he'd held a grudge. She dialed a number she hadn't called in 8 years. It rang twice. Colonel Morrison. It's Keller. Silence. Then, I heard you were back. I need to know something. That general who showed up tonight, who sent him? Morrison hesitated. I don't know what you're talking about. Don't lie to me, Morrison. We both know that reinstatement order was bullshit. I filed my resignation properly. You witnessed it. Another pause. Someone pulled strings. High up. I don't know who. Hastings? He's a captain. He doesn't have that kind of power. Then who does? I can't tell you that over the phone. Then meet me. Tonight. Keller, tonight. Or I go public with everything I know about Kandahar. Morrison swore under his breath. There's a diner on 5th and Marshall. 1 hour. He hung up. Evelyn stood, her legs unsteady. Voss appeared beside her. Where are you going? To get answers. You need medical attention. I need the truth more. She started walking toward her car, then stopped. Her car was still parked at the chemical plant. Voss sighed. I'll drive you. Matt. The diner was nearly empty when they arrived. Just a couple of truckers nursing coffee and a waitress who looked like she'd rather be anywhere else. Colonel Morrison sat in a back booth, out of uniform, looking older than Evelyn remembered. She slid into the seat across from him. Voss stayed at the counter, giving them space but keeping watch. Morrison looked at her. You look like hell. Thanks. He pushed a folder across the table. This is everything I could pull without raising flags. Evelyn opened it. Inside were orders, communications, email chains, all pointing back to the same source, General Marcus Thornton, the man who'd shown up at the hospital. Thornton's been trying to bring you back for years, Morrison said quietly. He thinks you're the key to fixing the field hospital's survival rates. They've dropped 15% since you left. So he fabricated a recall order. He didn't fabricate it. He used a loophole. Your resignation paperwork got flagged during a records audit. Some technicality about it being filed during a deployment. Technically, it was never valid. Evelyn's jaw tightened. That's bullshit. That's the military. Morrison leaned back. But it gets worse. Thornton's been working with someone on the outside, someone who wanted you discredited. Hastings. Morrison nodded. He's been feeding stories to the media, digging up old files, making you look like a coward who abandoned her post. Why? Revenge, probably. You ruined his career. Now he's returning the favor. Evelyn looked at the papers, at the evidence of a coordinated smear campaign, at the conspiracy designed to destroy her. There's more, Morrison said. He pulled out another document. The bombing tonight. The fire marshal's report isn't complete yet, but I have a source who says they're looking at military-grade accelerant. Evelyn's stomach dropped. You think Thornton? I think Thornton wanted you desperate, wanted you with nowhere else to go, so you'd have no choice but to come back. He tried to kill people to manipulate me? Morrison's expression was grim. I don't have proof, but the timing's suspicious. Evelyn stood. Where is he? Keller. Where? Morrison sighed. He's staying at the Monarch Hotel downtown, room 412. But if you go there, Evelyn was already walking out. Voss caught up to her in the parking lot. What did he say? Everything. Evelyn unlocked the car. The recall order, the media campaign, the bombing. It's all connected. To who? A general with a vendetta and a captain with a grudge. Voss grabbed her arm. If the military's behind this, you can't just walk in there. You need lawyers. You need witnesses. I need them to stop. Evelyn pulled her arm free. They tried to destroy me. They put patients at risk. They bombed a hospital, and I'm done running. She got in the car. Voss got in the passenger side. Then, I'm coming with you. Us. The Monarch Hotel was downtown, all glass and steel and expensive minimalism. Evelyn walked through the lobby like she owned it, Voss right behind her. The elevator took them to the 4th floor, room 412. Evelyn knocked. The door opened. General Thornton stood there, still in uniform, his expression shifting from surprise to annoyance. Commander Keller, I thought I told you, we need to talk. I gave you 24 hours, shout. Did you bomb my hospital? Thornton's face went cold. Excuse me? The ER, tonight. Someone planted accelerant and set it on fire. Was it you? I don't know what you're talking about. Then you won't mind if I bring the fire marshal up here to ask you himself. Thornton stepped back. You should leave. Not until you tell me why you're doing this. Evelyn stepped inside, forcing him to retreat further. The fake recall order, the media hit pieces, the bombing, all to get me back into a uniform? You're a valuable asset. I'm a person. Her voice cracked. And you tried to burn down a hospital full of patients to manipulate me. I didn't burn anything. Thornton's voice was hard now. But if I had, it would have been worth it. Do you know how many soldiers have died because you weren't there? How many field hospitals have failed because they don't have someone with your skills? That's not my responsibility anymore. It is when you're the only one who can do it. There are other surgeons, not like you. Thornton stepped closer. You had a 96% survival rate in combat conditions. No one else has ever come close. You created protocols that saved thousands of lives, and then you walked away because one kid died. Evelyn's hands curled into fists. So yes, Thornton continued, I pulled strings. I used loopholes. I did whatever I had to do to bring you back. Because soldiers are dying and you're mopping floors. That's not noble, that's selfish. The words hit like a punch. Voss stepped forward. You need to leave. Now. This doesn't concern you. It does when you bomb my hospital. Voss pulled out her phone. I've already called the FBI. They're very interested in talking to you about the accelerant used tonight. Military grade, apparently. The kind only someone with your clearance could access. Thornton's face went pale. You have no proof. Not yet. But they're pulling security footage now, and hotel records, and phone logs. Voss smiled, cold and sharp. So unless you want to spend the next decade in federal prison, I suggest you back off. For a long moment, Thornton said nothing. Then he turned to Evelyn. You're making a mistake. No, Evelyn said quietly. I already made my mistake. 8 years ago, when I let people like you convince me I was only worth what I could do for them. I'm not making that mistake again. She walked out. Voss followed. In the hallway, Evelyn's legs nearly gave out. She leaned against the wall, breathing hard. Did you really call the FBI? She asked. Voss grinned. Not yet, but I will. They took the elevator down in silence. When they reached the lobby, Miranda was waiting. I've been calling you. What happened? The fire marshal just released a statement. They've identified the accelerant, and they've identified a suspect. She turned her phone around. On the screen was a mugshot. Captain Derek Hastings. They arrested him an hour ago, Miranda said. Security footage shows him entering the hospital through a service entrance 20 minutes before the explosion. He had a military-issued incendiary device in his bag. Evelyn stared at the photo. He confess? Not yet. But they've got him dead to rights. Miranda put her phone away. It's over, Keller. They can't touch you now. Evelyn didn't feel relief. She just felt tired. They walked out into the night air. The city was quiet. No sirens, no chaos. Just the low hum of traffic and the distant sound of construction crews already working to clean up the hospital. Voss's phone buzzed. She looked at it, her expression softening. The patient from Trauma Bay 3, the one you pulled out, he's awake, asking for you. Evelyn looked at her. He's okay? Stable. Neurofunction intact. He's gonna make it. Something in Evelyn's chest loosened. One more life, one more person who got to go home. Miranda handed her something. The contract. Singed around the edges, stained with soot, but still intact. You dropped this, Miranda said. Evelyn looked at the paper, at the signature line, at the choice she'd been running from for 3 months. She pulled out a pen and signed. Miranda smiled. Welcome to Riverside General, Dr. Keller. 3 days later, the hospital was still standing. The ER wing was gone, burned to the foundation, but the rest of the building was intact. Temporary trauma bays had been set up in the parking lot. Military-style field tents, complete with equipment donated from bases across the country. Evelyn stood in the center of one, reviewing charts, coordinating care, doing the job she'd tried so hard to escape. And for the first time in 8 years, it didn't feel like a burden. It felt like purpose. Voss appeared at her shoulder. You've got a visitor. Evelyn looked up. Corporal James Davis stood in the entrance out of uniform, a cane in his hand, the soldier who'd first recognized her. Commander, he said, then corrected himself. Doctor. Evelyn set down the chart. Davis, how are you? Better, thanks to you. He stepped closer. I heard what happened. The fire, the bombing, all of it. Yeah. I also heard you signed on officially. I did. Davis smiled. Good. The world needs more people like you. He held out his hand. Evelyn shook it. Thank you, Davis said quietly, for not giving up. On me. On any of us. He turned and walked out. Evelyn watched him go, something warm settling in her chest. Voss handed her another chart. We've got a GSW incoming. ETA, 3 minutes. Okay, let's get ready. They prepped the bay together, moving in sync, the kind of rhythm that came from trust and experience. The ambulance arrived. The patient came through, and Evelyn stepped forward, her hand steady, her mind clear. She was done running, but as she worked, she didn't see the figure watching from across the parking lot. A man in a dark suit phoned to his ear. She signed the contract, he said. Thornton's in custody. Hastings is talking. A pause. No, she doesn't know yet. Another pause. Understood. I'll keep monitoring. He hung up and disappeared into the crowd. Inside the tent, Evelyn saved another life, unaware that the real threat had just begun. The GSW patient survived. Evelyn closed him up in the field tent at 4 a.m, her hand steady despite the exhaustion crawling through her bones. The bullet had missed the major vessels by millimeters, luck more than anything else, but she'd take it. She stripped off her gloves, tossed them in the bin, and walked out into the cool pre-dawn air. The parking lot was quiet now. Most of the staff had gone home. A few nurses restocked supplies in the adjacent tent. Security guards patrolled the perimeter, their flashlights cutting through the darkness. Evelyn sat on the bumper of an ambulance, her body finally allowing itself to feel the weight of the last 72 hours. Her phone buzzed, a text from Miranda. My office, 7 a.m., need to discuss something. Evelyn stared at the message, too tired to decode corporate speak. She closed her eyes just for a moment and heard footsteps. She looked up. The man in the dark suit stood 10 feet away, hands in his pockets, his expression unreadable. Evelyn stood slowly. Can I help you? Dr. Keller. His voice was smooth, controlled. My name is Agent Robert Castellano, FBI. He held out a badge. Evelyn looked at it, then at him. It's late for a federal visit. I apologize, but this couldn't wait. He gestured toward the hospital. May we speak somewhere private? Evelyn led him to the break room, or what was left of it. Half the furniture was gone, destroyed in the fire. What remained was covered in soot. She sat on the edge of a table. Castellano remained standing. Captain Hastings is talking, he said without preamble. Good. He's admitted to planting the incendiary device, but he's claiming he didn't act alone. Evelyn's jaw tightened. Thornton. General Thornton is already in custody, but Hastings is alleging there's a third party, someone higher up the chain who orchestrated the entire operation. Who? Castellano pulled out a tablet, showed her a photo. A man in his 60s, silver hair, expensive suit, the kind of face that belonged in boardrooms and congressional hearings. Richard Galvin, Castellano said, CEO of Galvin Medical Solutions, one of the largest defense contractors in the country. They supply field hospitals, trauma equipment, surgical tech to the military. Evelyn stared at the photo. I don't know him, but he knows you, or more specifically, he knows your work. Castellano swiped to another image, a document. The Keller Protocol, your mass casualty triage system. The military adopted it 8 years ago. Survival rates went up, costs went down. It saved lives and saved money. So Galvin Medical wanted to patent it, turn it into proprietary software they could license to governments worldwide, worth billions. Castellano looked at her. But you refused. You said it should be public domain, free for anyone who needed it. Evelyn remembered. A lawyer had contacted her 6 months after she'd published the protocol, offered her money, contracts, fame. She'd turned him down. Galvin didn't take it well, Castellano continued. He tried to patent it anyway, claiming he'd developed it independently. You filed a lawsuit, won. The protocol stayed public. That was 8 years ago. And he's held a grudge ever since. Castellano swiped again. When you left the military, Galvin saw an opportunity. Field hospital survival rates dropped without you. The military started looking for solutions. Galvin pitched them a new system, his own protocol, rebranded, packaged, expensive. But it didn't work as well as yours. He showed her a graph. Survival rates declining over the years. So he needed you discredited, Castellano said. If the legendary Commander Keller was a fraud, a coward, a deserter, then her protocol was worthless too, and the military would turn to him. Evelyn felt cold. He orchestrated all of this? The recall order, the media campaign, the bombing? We believe so. Hastings and Thornton were his tools. He pulled the strings. Castellano put away the tablet. But here's the problem. We don't have hard evidence linking him to the conspiracy. Just Hastings' testimony, and Hastings is a disgraced officer facing federal charges. His word alone won't convict Galvin. Then what do you need? You. Castellano met her eyes. Galvin's hosting a medical technology summit tomorrow night, a gala event. He's unveiling his new trauma protocol to potential buyers, foreign governments, private hospitals, anyone with deep pockets. If you're there, if you confront him publicly, he might slip. Say something incriminating. You want me to wear a wire? I want you to get justice. Evelyn stood. And if he doesn't slip? If he's smart enough to keep his mouth shut? Then he walks away. And he wins. The words hung in the air. Evelyn looked at her hands, still shaking even now. I'll do it, she said quietly. Castellano nodded. Good. We'll have agents in place. You'll be safe. I'm not worried about me. Evelyn looked at him. I'm worried about what happens when this is over. You take down Galvin, expose the conspiracy. Then what? The military still wants me back. The media still thinks I'm a coward. None of that changes. Castellano's expression softened. Maybe it doesn't, but you'll know the truth, and so will everyone who matters. He handed her a business card. The gala's at the Pinnacle Center, 7 p.m. There's a ticket waiting for you at the door. He left. Evelyn sat alone in the ruined break room, staring at the card. One more fight, then it would be over. Evelyn didn't sleep. She went home, showered, and stared at her closet. She owned exactly 2 outfits that weren't scrubs or uniforms, jeans and a sweater, or jeans and a different sweater. Nothing appropriate for a black tie gala. At 9 a.m., there was a knock on her door. She opened it to find Voss standing there, holding a garment bag. Miranda told me where you live, don't ask how. What's this? You can't show up to a gala looking like you just crawled out of a war zone. Voss pushed past her, hung the bag on the door. It's my sister's. She's about your size. It's a loaner, so don't bleed on it. Evelyn unzipped the bag. Inside was a black dress. Simple, elegant, nothing flashy. I can't. You can, and you will. Voss sat on the couch. Miranda briefed me. You're going after Galvin. The FBI's going after Galvin. I'm just the bait. Same thing. Voss leaned forward. Are you scared? Terrified. Good. That means you're smart. Voss stood. But you're also the toughest person I've ever met. So go get him. She left. Evelyn spent the rest of the day preparing. Agent Castellano sent over files, Galvin's background, his company, his connections. She read every page, memorized every detail. By the time 6 p.m. rolled around, she knew more about Richard Galvin than she knew about herself. She put on the dress, pulled her hair back, and looked at herself in the mirror. She didn't recognize the person staring back. The woman in the mirror looked confident, composed, like someone who belonged in boardrooms and galas, not like someone who mopped floors. Her phone buzzed. A car was waiting downstairs. She grabbed her coat and went. The Pinnacle Center was downtown, all glass and marble and expensive art. Evelyn stepped out of the car, her heels clicking on the pavement, and felt completely out of place. Security checked her name against the list, waved her through. Inside, the gala was already in full swing. Hundreds of people in tuxedos and gowns, champagne glasses in hand, circulating through a massive ballroom. A string quartet played in the corner. Waiters moved through the crowd with trays of hors d'oeuvres. Evelyn felt like she'd walked onto a movie set. Agent Castellano appeared beside her, dressed in a tuxedo that fit too well to be rental. You clean up nice. Where's Galvin? Center of the room, holding court. Castellano handed her a champagne glass. The wire's in your necklace. Just get close, start a conversation, see if he takes the bait. Evelyn looked down. The necklace was simple, a silver chain with a small pendant. She hadn't even noticed it when Voss had included it with the dress. We're recording everything, Castellano said. You're not alone. He disappeared into the crowd. Evelyn took a breath and started walking. She found Galvin exactly where Castellano had said, surrounded by admirers, a drink in his hand, his smile practiced and perfect. He was in the middle of a story, something about a humanitarian mission in Africa, and everyone was laughing. Evelyn waited until he finished, then stepped forward. Mr. Galvin. He turned, his smile faltering for just a moment when he saw her. Then it returned, wider than before. I'm sorry, have we met? No, but I know your work. She extended her hand. Dr. Evelyn Keller. His grip tightened just slightly before he let go. Dr. Keller, what a surprise. I didn't expect to see you here. I could say the same about you hosting a medical summit. Last I checked, you were in the business of selling equipment, not protocols. His smile didn't waver. The business has evolved. We're offering comprehensive solutions now. Trauma protocols, training systems, integrated care platforms, the future of battlefield medicine. Based on whose research? Ours, of course. Developed by our team of experts over the last 5 years. Funny, it sounds a lot like the protocol I published 8 years ago. The people around them had gone quiet, listening. Galvin's smile tightened. I'm sure there are similarities. Great minds think alike. Or one mind steals from another. His expression hardened. Be careful, Dr. Keller. Accusations like that can be dangerous. So can bombing hospitals. The room went silent. Galvin's face drained of color. I have no idea what you're talking about. Don't you? Evelyn stepped closer, her voice low enough that only he could hear. Captain Hastings, General Thornton, the recall order, the media campaign, the incendiary device planted in my ER, all to discredit me so you could sell your knockoff protocol. You're insane. Am I? Or are you just that desperate? Evelyn's voice was cold now. You couldn't beat me in court, so you tried to destroy me. You risked innocent lives, burned down a hospital, all for what? Money? Galvin leaned in, his voice a hiss. You don't know what you're talking about. Then prove it. Tell everyone here that you had nothing to do with it. He straightened, his composure returning. I don't need to prove anything, especially not to someone who abandoned her post and spent 3 months hiding from her responsibilities. I didn't abandon anything. I walked away from people like you. Galvin smiled, but it didn't reach his eyes. And yet here you are, back in the fight, still trying to be the hero. But you're not a hero, Dr. Keller. You're a broken woman clinging to a past that doesn't want you anymore. Evelyn felt the words hit, felt the weight of them pressing down on her chest, but she didn't flinch. You're right, she said quietly. I am broken. I've made mistakes. I've failed people. But at least I tried to save lives. What have you done? Built a company on the backs of soldiers who trusted you? Sold faulty equipment that got people killed so you could pad your profit margins? Galvin's jaw tightened. I know about the recalls, Evelyn continued. The defective ventilators in 2019. The contaminated IV solutions in 2021. All swept under the rug with settlements and NDAs. How many people died because you cut corners? That's slander. It's the truth. Evelyn pulled out her phone, held it up. And I've got the documents to prove it. She didn't, but he didn't know that. Galvin's mask slipped. You think you can threaten me? You think anyone will believe you over me? I have lawyers, connections, senators on speed dial. You're nobody. Maybe. But I'm the nobody who just got you on record admitting you know about Hastings and Thornton. His face went white. Around them the crowd had pressed closer, phones out, recording. Galvin grabbed her arm. You're making a mistake. Let go of me. He didn't. Agent Castellano appeared, flashing his badge. FBI, remove your hand, mister. Galvin. Galvin released her, stepping back. Castellano looked at the crowd. This event is over. Everyone needs to leave. Now. Security started ushering people out. Galvin turned to run. 2 more agents blocked the exit. Castellano stepped forward. Richard Galvin, you're under arrest for conspiracy to commit arson, attempted murder, and fraud. You have the right to remain silent. This is insane, Galvin shouted. I didn't do anything. Hastings acted alone. Then why did you just admit to knowing about him? Castellano cuffed him. You said I should be careful about accusations. Funny thing to say if you didn't know what I was accusing you of. Galvin's face crumpled. I want my lawyer. You'll get one. Castellano started walking him toward the exit. But right now, you're coming with us. They disappeared through the door. Evelyn stood in the empty ballroom, her heart pounding, her hands shaking. It was over. A slow clap echoed through the room. She turned. Miranda stood in the doorway, Voss beside her, both smiling. That, Miranda said, was beautiful. Done. The next morning, the news broke. Defense contractor arrested in hospital bombing conspiracy. Galvin Medical CEO charged with attempted murder, fraud. Hero surgeon exposes corruption in military medical supply chain. Evelyn watched the headlines scroll past on her phone, sitting in the rebuilt break room at Riverside General. The ER wing was still under construction, but the field tents had been upgraded, expanded. They were handling more patients than ever. Doctor. Voss walked in, 2 cups of coffee in hand. She set one in front of Evelyn. You're famous again. I was hoping that part was over. Not a chance. The media loves a redemption story. Voss sat down. But this time, they're getting it right. No more hit pieces. Just facts. Evelyn sipped her coffee. What about Thornton and Hastings? Military tribunal for Thornton, federal prison for Hastings. And Galvin's looking at 20 years minimum. Voss leaned back. They're all going down. Because of you. Because I got lucky. Because you didn't give up. The door opened. Miranda walked in, tablet in hand. We need to talk about your schedule. Evelyn looked up. What schedule? You're the head of trauma now. That comes with responsibilities, department meetings, budget reviews, staff training. I didn't agree to be head of trauma. You signed a contract that says otherwise. Read the fine print. Miranda smiled. But there's more. The mayor wants to give you a commendation. The governor wants you to testify before the state legislature about hospital safety. And I've had 17 media requests for interviews. Evelyn groaned. You're also being considered for a position at the National Trauma Registry, Miranda continued. They want you to help develop new protocols based on your field experience. I can't. You can, and you will. Miranda set down the tablet. But here's the thing. You get to decide how. You want to take the interviews? Fine. You want to skip them? Also fine. You want to focus on patient care and let someone else handle the bureaucracy? We can make that work too. Evelyn looked at her. Why are you doing this? Because 3 months ago, you were mopping floors, and now you're saving lives. I'm not about to let that go to waste. Miranda left. Voss grinned. She likes you. She's terrifying. That too. Evelyn's phone buzzed. A text from Colonel Morrison. Saw the news? Well done. For what it's worth, your resignation is now officially processed. You're free. Evelyn stared at the message. Free. She'd spent 8 years running from that word, and now it felt like the weight she'd been carrying had finally lifted. Voss nudged her. You okay? Yeah. Evelyn stood. I think I am. But 6 months later, Riverside General had a new ER. Bigger. Better. State-of-the-art equipment donated by organizations that had heard Evelyn's story and wanted to help. The field tents were gone, replaced by trauma bays designed using the Keller protocol. Efficient, adaptable, built for mass casualty events. Evelyn stood in the center of it all, clipboard in hand, overseeing the controlled chaos of a Friday night shift. A resident ran up. Doctor, Keller, we've got a multi-vehicle collision incoming, at least 8 critical. Okay, set up triage in Bay 1, red tags to Bays 2 and 3, yellow to 4 and 5. I want vitals on everyone within 90 seconds of arrival. The resident nodded and ran. Evelyn followed, her movements automatic now. No hesitation, no fear, just purpose. The ambulances arrived. The patients poured in, and Evelyn moved between them, tagging, assessing, making decisions. Red, yellow, red, green. No black tags tonight. By midnight, all 8 patients were stabilized. 7 were in surgery. 1 was already out, recovering in the ICU. Evelyn stood in the hallway, watching the monitors, checking vitals. Voss appeared beside her. 8 for 8, not bad. Could have been better. It's never perfect, but it was damn good. They stood in silence for a moment, then Voss said, There's someone here to see you. Evelyn turned. Corporal Davis stood at the nurse's station, out of uniform, looking healthier than the last time